I am Dr. Bharat Vaswani, Senior Consultant Medical Oncologist and Hematologist, practicing at Yashoda Hospital, Hyderabad. Colorectal cancer is the fifth most common cancer in India, and it is the most common cancer in gastrointestinal tract. Every year, approximately 65,000 new patients of colorectal cancer are diagnosed in our country. The causes of colorectal cancer are multi, but the most common cause is the lifestyle. A diet rich in processed meat, including red meat, with a low intake of fiber is supposed to be the most common cause. It is also related to history of smoking and alcohol. The second common cause is obesity. Approximately 5 to 10% of colorectal cancers are due to hereditary familial adenomatous polyposis and hereditary non-polyposis colorectal cancer, which we call as Lynch syndrome. There is a subset of patients where the history of inflammatory bowel disease is present. Colorectal cancer is diagnosed through multiple ways. In the previous times, the most common test used was a fecal ocal blood test, which is normally not used now. The best test to diagnose colorectal cancer is a colonoscopy. The added advantage of using a colonoscopy is we can do a biopsy in the same setting. For metastatic workup, we do CT scan abdomen pelvis with contrast and rarely a PET CT scan. Now, when we talk about screening of colorectal cancer, screening means diagnosing colorectal cancer in those patients who does not have any symptoms. The most important thing in colorectal cancer is that there is a preceding history of polyps. So on polyps, this colorectal cancer develops. So doing a colonoscopy in a general population every 10 yearly after age 50, and those with a family history doing it 5 years earlier than the youngest diagnosed member can help in picking up this cancer faster. The treatment of colorectal cancer is multifaceted. So in an early stage, which we call as stage 1, where the cancer is localized only to colon, we do surgery only. Now when the cancer spreads to the surrounding lymph node, which we call as stage 3, the surgery is followed by 3 to 6 months of chemotherapy. And if the patient is diagnosed in stage 4, we require palliative chemo. Now, recently there are a lot of new drugs that are coming up, including immunotherapy, which has improved the lifespan of colorectal cancer tremendously. But the best way to reduce the incidence of this deadly disease is to improve our lifestyle. So a diet which is rich in fruits and vegetables and restricting the intake of non-veg, processed and the red meat may help in reducing the incidence of this deadly disease. Last but not the least, maintaining a proper body weight, including regular exercise, will go in a long way in reducing the incidence of this disease. Thank you all.